Welcome to this COVID-19 awareness program brought to you by OHSS Consulting. In this module, we will discuss what an employer should do to ensure a compliant COVID-19 management system. It is important to note that this course is not exhaustive, and the procedures must be read in conjunction with other relevant, updated guidelines or regulations from the National Department of Health, Departments of Employment and Labor, Mineral Resources and Energy, Public Services, and Administration. Ensure you and your company are fully up to date with the governmental guidelines on COVID-19 prevention. As an employer, your actions taken after a positive case or potential positive case can help to stop the spread of the COVID-19 virus. The following are some key aspects to be addressed in dealing with identification and management of COVID-19 positive workers. Firstly, let us take a look at the personal health procedures. All companies should have a company guideline or standard operating procedure in order to provide prompt counseling and support to the employee. You should promptly provide the employee with a surgical mask and relocate the employee to a secure, well-ventilated area if the employee presents at the workplace. This should ideally be identified prior to such an incident. You should also provide or arrange for their clinical condition to be assessed with respect to their personal health care, whether a workplace provider or a private healthcare provider is used. If the employee does not need admission and is sent home, ensure that the employee undergoes self-isolation at home or at a designated isolation facility identified by the employer in line with the National Department of Health guidelines. Employers are to ensure that the worker is not discriminated against on grounds of having tested positive for COVID-19. Note that COVID-19 personal health interventions are part of the prescribed minimum benefits of the Council for Medical Schemes. Secondly, public health communicable disease procedures. Employers are to report the personal details to the National Institute for Communicable Diseases in line with the Notifiable Medical Conditions Protocols. All employers are to ensure that they, with the appropriate authorities, initiate contact tracing of fellow employees, patient contacts, family and community by working with all relevant stakeholders such as outlined in the National Institute for Communicable Diseases Guidelines for Case Finding, Diagnosis, Management and Public Health Response in South Africa. Employers are also to assist district or provincial health authorities and the NICD to identify close contacts and facilitate quarantine and/or isolation as per the guidelines above. Thirdly, employers are to ensure infection prevention and control procedures. You should identify infection prevention and control practitioners that are able to advise on specific IPC procedures to be followed in the workplace. Workplaces can access this through Provincial Department of Health or via the National Institute of Communicable Disease hotline at 0800 029 999. Employers should implement protocols to prevent further infection spread in the workplace to workers, clients, visitors, and suppliers. Depending on the initial investigation and the number of infected workers, this may entail temporary closure of affected work areas for decontamination in line with the relevant regulatory authorities' guidance. Point number 4 in our COVID-19 compliance management system is workplace-related occupational health and safety procedures. all relevant staff members, preferably staff of the Occupational Health Services, must conduct an incident-based risk assessment to find out what went wrong, identify lapses in current workplace control measures such as disinfection, personal protective equipment, social distancing, education and training, staff symptom screening, testing, monitoring, and take steps to address gaps. Good cleaning and decontamination of the area that has been identified as per COVID-19 national IPC guidelines. Employers should also implement improved control measures based on the risk assessment in consultation with the Health and Safety Committee and/or the COVID-19 Compliance Committee. In continuation of workplace-related occupational health and safety procedures, employers are to communicate details of the incident in accordance with the appropriate communication lines that exist with management, Health and Safety Committee and/or COVID-19 Committee, and co-workers, including organized labor, notwithstanding respecting the confidentiality rights of the affected employee. Employers are to communicate incident investigation and remedial measures taken to relevant authorities and committees. You should also manage return to work of affected employees in line with protocols and special circumstances, which should include completion of isolation period, ensuring public health, personal hygiene and social distancing measures, and ongoing close symptom monitoring of the employee on their return to work. Point number 5 are labor relations procedures. Management and labor should use the incident to work collectively and cooperatively to safeguard employees and the workplace to prevent future lapses and incidents. Management and organized labor should work cooperatively to address issues and strengthen labor relations to deal with challenges on an ongoing basis. Organized labor representatives, health and safety representatives, and committees should provide ongoing feedback to management on areas needing attention, such as control measures, access to appropriate PPE, education and training needs, health and isolation support, leave, or other issues identified by employees. Incident reporting and engagement with relevant regulator is point number 6. The employer is to inform the relevant authorities such as Departments of Employment and Labor, Mineral Resources and Energy, Public Service and Administration, and/or the relevant Provincial Department of Health Public Health Response Teams. The employer is to initiate a joint meeting with relevant authorities, safety officers, health and safety committees, and relevant management staff to outline actions taken to date and propose plans of action and timelines to reduce further exposure and health transmission risk. You are also to enlist the assistance of the relevant inspectorate to support workplaces in using the prescribed approach in addressing any lapses in control measures and to ensure the health and safety of the workers in the workplace. The last point is about leave and workers' compensation arrangements. The employer is to proactively facilitate all applicable leave requests, such as sick leave, in terms of Section 22 of the Basic Conditions of Employment Act. The employer is to report all alleged, presumed, and confirmed cases of COVID-19 related occupational disease to the Compensation Commissioner in the prescribed format, using the relevant documentation as required in terms of the Compensation for Occupational Injuries and Disease Act. Employers are to facilitate procedures for all workers' compensation benefits available to employees. This would include leave for temporary disability, assessment by an occupational medicine practitioner, specialist, in cases of complex disease that may result in permanent disability, the provision of medical aid for the testing and treatment, as well as permanent disability assessments. Finally, the compensation to dependents in case of death. Let's recap. Employers are to ensure they have the following in conjunction with their COVID-19 compliance management system. Why not sit down with your COVID-19 compliance officer and check the following: your personal health procedures, the public health communicable disease procedures, the procedures for infection prevention and control, your workplace-related occupational health and safety procedures, the procedures for labor relations, incident reporting and engagement with relevant regulator, as well as your company's leave and workers' compensation arrangements. Thank you for completing Module 3. Please answer the questions below before moving on to Module 4.